Now we're going to talk about the patient exam. The patient exam we're going to break up into 3 different segments. First thing we do is select a patient. We can begin typing in their name. If they're in the system, their name will show up down here along with their date so that we can make sure it's the correct patient. Click on that. If this is the patient's first exam, these 2 boxes will not show up. But if they have come in before and you've done an exam on them, this box will show up pre-checked. What this means is it will load the data, the history, concerns, all that from last exam you did. If you would like to overwrite or finish an exam that you stopped, then you can check this and it will actually overwrite the last exam so that this exam on August the 2nd would just disappear. So for this one, we're not going to load previous, we're just going to start from scratch. And here we choose who performed the exam. It's going to default to your default user. So we will click continue. This page is for patient concerns. Any patient concerns you can just check. Again, these are essentially the reason why your patient came. Click continue. Now this we get into a little bit of health history. You can check a few things here. Some of these are modifiable risk factors that will affect the diagnosis at the end of the exam. Tobacco, for instance, will increase case type for periodontal disease to a plus, and we'll get into that in a little while. I will click continue. Now we jump into the exams. It's going to start out with the periodontal exam. We can go down and click whatever applies. What we're doing here is clicking items that we want to include in a report. You need to keep in mind that this is not your practice software. Your practice software will be very detailed and you'll track everything. If it's something that is there but you don't want to include in a report, then don't click it. You'll notice some of the boxes will be pre-checked based on different things. Our software knows the patient's birth date, so it knows if they're over 40 years old. So we've clicked risk factors and clinical evaluations. We're going to click continue, and now is our diagnosis. Our software is currently using the 1989 AAP diagnosis and protocol. Also keep in mind our software does not make the diagnosis for you. Based on your evaluation of your patient, you will click the case type that they are. What our software has done is upgraded each case type to a plus based on those modifiable risk factors such as smoking. So I'm just going to check on one and then we'll hit continue. It's going to next move us into the caries. Caries works a little bit different. We still click on the evaluation, and when we go to the next screen, whoops, see I didn't complete a radio button somewhere. Well, right here, it's going to mark it, give me an alert. It's going to mark it. When we click on to the next screen, we're going to get a matrix. Our software, again, is not going to diagnose, but it's going to show you the risk level for each of the items that you checked. And based off of this, it's just an easy reference. Now you can hop over here and make your diagnosis, but you do have to make the diagnosis. Click continue. And then we're into the oral cancer exam. And this one will instantly highlight this in red if you pick something up. Say we found something on their face. Now we have to fill in down here positive or negative findings. We can say, okay, that's positive. Click continue. This one will be risk factors. So we'll check a few things here. Based on those, I'm going to say it's elevated risk. And then our part 3 is going to be treatment recommendations. click those, and then we'll click continue on. Also notice that we can jump back and forth anywhere on these tabs or these tabs. So if I want to go back and change something in the periodontal exam, I can just click back to it. Say I forgot to mark that one, and I can jump back up here. I can also jump to a specific page, anywhere I want, make changes. I can also jump back into patient info. The one part I cannot jump to from these tabs is the select patient. I might have to start a new exam to get to the select patient. Alright, so now that I've gone through the exams, made my diagnoses, I will move to the next screen, and that's going to be in our next video.